Being sure to remove jewelry, the therapist will use a cleansing agent, in this case hand sanitizer, to rub vigorously with friction the palms, interlaced fingers, dorsum of each hand, fingertips of each hand, each thumb, and each wrist. This process will be 1 minute in length. The wheelchair will be properly positioned flush against the bed, making sure that the unaffected leg is near the bed.
Okay, so I'm going to sanitize my hands prior to this. Hi, my name is David Gross. I'm a physical therapy student here at the University of St. Augustine. Might I have your first and last name, please?
Marta Chadu.
Perfect. And your date of birth?
05-13.
Awesome. And I'm just going to confirm that on your wristband. Good. So what we're going to be doing today is a standing assisted transfer. Now you have some limitations because you're a total hip replacement. So that's going to involve us preventing you going into trunk flexion past 90 degrees and internally rotating your hip when you stand up. So those are some of the things we got to pay attention to, and as well as crossing the midline of your body with your foot. Do you have any questions as far as your limitations?
No.
No. So when you do stand up, you may experience some dizziness or you might get a little lightheaded. Please let me know, that's normal. If it's a little too uncomfortable, we could sit you back down and we could do some exercises in the chair. Is that okay with you?
Yes.
Perfect. Do you have any questions?
No.
Do I have your permission to continue?
Yes.
Okay, so before we start, I'm gonna have you straighten out your right leg, okay? And then as we sit up to reach for the walker, you're gonna slide your hips forward, reaching with your right arm only, okay? And then as you come up, we're gonna take a couple of small steps and then back up and sit down into the chair, making sure that we only reach with our left hand behind us. Do you have any questions? May you repeat the steps back to me?
I repeat.
Perfect. So let's go ahead and get this seat belt set up on you. All right. So I'm gonna have you slide forward just with your hips, okay? Good. Now go ahead and lean forward with your trunk just slightly right there. Perfect. Hold that position for me. Good. And then can you point to your belly button? Perfect.
The therapist assures that the wheelchair is locked in place. The caster wheels have been set at a slight angle. They can also be straight. The leg rests are removed by helping the patient lift their affected leg and removing the other leg rest, making sure both are out of the way for the transfer. Therapist also locks the bed and adjusts the height, aligning with the seat height.
So what we're going to do is a total hip replacement transfer to the table. What I'm going to first have you do is I'm going to have you slide up a little bit so I can grab that gate post. Thank you so much. And next I'm going to have you slide that right foot forward and that left foot back. I'm going to have you slide with your hips first forward. Next what I'm going to have you do is going to have you push up with your arms and we're going to go ahead and stand. 1, 2, 3. Good. How do you feel?
Good.
Perfect. Slide that right foot back. Now slide the walker forward for me. Right foot first, then left. Now what we're going to do is we're going to turn the walker to the right a little bit. Good. Turn that right foot a little bit. Perfect. Now we're going to go ahead, turn that walker again. Right foot forward. Left foot. Next we're going to go ahead, take the walker back. Right foot forward, left. Walker back. Next. Perfect. And we're going to go ahead and slide that right foot forward a little bit. And we're going to go ahead and face that left hand down. Perfect. Are you okay?
Yes.
Okay. Any problem?
Thank you.